Hello and welcome to Cromwell Hospital's webinar on the prevention and management of running injuries. Thank you for joining us this afternoon. Please ask your questions using our chat function. Our speakers will try and answer as many as possible before the end of the webinar. This webinar is being recorded and you will be sent the recording tomorrow morning. I'd like to introduce you now to our speakers. Mr. Saket Tibrewal is a consultant trauma and orthopedic surgeon at Cromwell Hospital. He is solely dedicated to treating knee problems and operates exclusively on the knee. Therefore, he has extensive experience and one of the highest volume clinical practices, which covers all aspects of knee surgery. This includes partial and total knee replacement, cartilage regeneration and repair, knee ligament reconstruction, and sports injuries. His core philosophy is to listen to his patients and in order to fully understand their individual needs and aspirations. I'd also like to introduce you to Dr. Timothy Swan, who is a consultant in sports exercise medicine. He served in the Army for over 20 years and has extensive experience in sport and exercise medicine in diagnosing and treating and managing musculoskeletal and sports injuries. Dr. Swan endorses a multidisciplinary team approach, working with the patient and physiotherapy team. He has worked across a diverse range of elite sport teams and athletes. He has extensive experience in sports and exercise medicine and is able to diagnose, treat, and manage a wide range of musculoskeletal and sport injuries. And finally, I'd like to introduce you to Brent Cohen, Senior Musculoskeletal Physiotherapist, who is part of our expert physiotherapy team here at Cromwell. The Musculoskeletal Physiotherapy Service assesses, diagnoses, and treats a broad spectrum of MSK conditions. And now I'd like to hand you over to our wonderful panel who will start the session.
We've got any slides showing, Hattie?
No slides yet. I think they're just pulling them up. So thank you everyone for your patience. As a reminder, you should be able to add questions in the chat function. That will be open the entire session and we will try and get to everyone's questions.
Yeah, here we go. Can you see this now?
Yes, thank you.
Yep. Okay, so thanks, Hattie. Thanks for the introduction. As mentioned, I'm Saket Tibrewal. I'm the surgeon. We've got Tim Swan and Brent Cowan as well. And we're going to be having a chat about running injuries. As we just had the London Marathon, there's obviously a lot of interest in this. Running's becoming ever more popular. I was just mentioning that this year I've seen more running injuries than other things, such as skiing injuries, which I normally deal with around this time of year. And you know, running is very popular because it's an excellent sporting activity, great for cardiovascular health. It's easy to pick up a pair of trainers and head out the door. But nearly 50% of runners get injured annually. That's mainly because there's a lack of understanding in terms of what's involved in running and what's important. Most of the injuries are preventable, but with the right knowledge, and we're going to try and touch on that today. So whether you're someone who's just about to take up running or you're a seasoned runner, we might be able to provide you with a bit of advice and help on how to take things forward. I thought we'd start with a bit on the biomechanics of running, and happy for Brent and Tim to sort of just step in at any point. But really, your running or gait cycle, it starts with heel strike. So as you're running along, the heel strikes the ground. Your arches of your foot become involved, and so it all starts in the foot, and then it goes up through the chain, through the knee, up to the hip, and so on through the pelvis. So really, that whole chain's involved in running, and any issues anywhere along that chain can sort of be involved in some of the common pathologies that we face. Do Tim or Brent have any bits they want to put in here?
Yeah, I think definitely anywhere along the chain is where the problem's going to arise. but it's not necessarily where the problem that's happening that can be where it presents. You could have an issue that's coming from your knee, but it'd be driven from something else. So it's really important that everything's working really well in conjunction as a whole.
Yeah, I fully agree. I mean, examining the kinetic chain is important because, as you say, you may present in one area, but it can work its way up, and the load is 2 to 3 times, even 5 times at fast speeds, body weight, and that transmits up the kinetic chain. So you need to consider the foot, the knee, the ankle, the hip, and the back, because all of those will be affected by abnormalities in the gait function.
Very much.
Yeah, and I think what a lot of new runners don't know or haven't really faced is understanding the mechanics of their own sort of body and their gait, or their kind of the mechanics of how they load their joints when they're running. And so I think that's a key thing, where you maybe get people who are just starting off or training for their first marathon, and they do very quickly develop problems because they're maybe going a bit too hard, too fast.
And equally, people don't get taught to run. We just learn to run.
Yeah.
So most people don't consider how they run. They just try and run.
Correct. So here's just a list of the common things that come through clinic, which can be running related. You've got something called patellofemoral pain syndrome, or runner's knee, iliotibial band syndrome, shin splints, Achilles tendinopathy, plantar fasciitis, stress fractures, muscle strains, like especially hamstring, ankles, hip flexor muscles as well, and then patellar tendonitis or quadriceps tendonitis. And as you can see, it's a lot of the stuff that we've already mentioned, which is ankle, knee, hip. They're the 3 kind of areas that take the most load. And most of these injuries, I would say, are really overuse phenomena, where the body cannot, or these areas cannot take the load and forces that they're being subjected to, and the muscles around them are not able to offload those areas. I thought we could talk about a few of these. Start with runner's knee, I suppose, is the first one on the list. One of the sort of the most common things that I see is a patient coming in who's got pain, what we call anterior knee pain, so pain at the front of the knee, comes on with any activity really, but with running especially, or anything that where they're loading the knee with the knee bent, so in a flexed position, and that precipitates pain at the front of the knee. Particularly can be worse and sort of going uphill. And it can be, and quite commonly it's just an ache. It's rather than a pain, it's a dull ache at the front of the knee that's made worse with those activities, or going upstairs, sitting for prolonged periods. And treatment of this really is starting with these really simple measures first, which is kind of winding back the activity level, and then engaging in a good kind of rehabilitation program to see where, as we mentioned before, where along the chain those issues are.
Generally speaking, I'd say that in terms of the PFPS, or the runner's knee, one of the more common ones that I would see as well in an outpatient setting. And again, like you mentioned, Zach, it's a lot of it comes into that overload, whether that be an acute overload because someone's training more than they're used to, or because they've taken it up as a new challenge. But it's a very, very, very common presentation. And as you've said as well, the strengthening it's important to figure out where the issue's coming from, and then addressing that appropriately.
In the military, we are phenomenally good at causing patellofemoral pain syndrome because we run them and we give them weight. So it's a major consequence to us in terms of our training. But clearly, muscle mass and the quadriceps attached to the quadriceps tendon into the patellar tendon. The patellar tendon's fixed at the tibial tuberosity. So the more muscle mass you have, then the better the quality of the muscle, which causes more space when you bend your knee, and you get less friction between the patellofemoral joint, between the condyles and the facets on the medial and lateral aspects. So the rehabilitation is critical to recovering these people because the Germans, for example, used to do things like tibial tuberosity transfers and look at ways of trying to reconstruct the alignments, but generally speaking, they do very badly. So rehab for me all the way for this, and good rehab leads to good strengthening and good function.
Mm. When talking about good rehab, Brent, when you see these patients, do you kind of, how do you assess them? Do you kind of look at them, look at their alignment, see where their imbalances are? What's the kind of the process you go through?
So I always start with the feet, because I think foot function is your ground force reaction. So you need to see what's going on. What is their foot type? Are they a high arch, a normal arch, or a plain flat foot? If you look at podiatrists, which definitely have a mechanism of looking at foot function, you need to look at the windlass mechanism. So you do dorsiflexion of the first ray, because that's critical for running. And if you're restricted in dorsiflexion, then you can't push off when you go into plantar flexion, because you can't get extension. So if you're a limitus or you're a rigidus, or you've got osteophyte formation, then clearly you've got a problem with the push off, and that then restricts you in terms of running. That then starts to affect ankle function. You lose range of movement to your ankle function, then that will cause knee issue and work its way up to the hip and into the back. So seeing whether somebody has a leg length discrepancy or there's any asymmetry is pretty important, because lots of people don't recognize that they do have, and you need to look at the wear and tear on the soles of their shoes to see if there's any discrepancies between left and right, or whether their abnormalities biomechanically are even, and therefore what can you do? But obviously, if you've got a limitus in your first ray, then you can put things like metatarsal bars under their padding underneath their orthotics. You can cut away the first ray so that the first ray is dropped, so that they don't need so much extension, because the other toes are raised and relative to the first ray. So there's lots of things you can do to address abnormalities, but you need to start from the feet and work upwards and examine the kinetic chain.
Yeah. I think for a physio aspect as well, beyond looking at the biomechanics, it's a functional assessment as well, whether that be walking or whether that be squats or single leg stance activities, different things like that. Even just as far as running, if there's an analysis of the running and there's obvious issues as to where the problems could be coming from that too, it gives a really good indication as to where we need to go with the rehab, where we need to go with the strengthening or an exercise approach.
Yeah, you mentioned glute weakness before with single leg squatting and doing medialization of the knee and poor control, trying to drive the knee over the toes. Things like that are a good way to assess what people's strengths are. Yeah.
You can certainly pick apart where issues can come from when you break down the function and break down the activity.
Yeah, excellent. We don't want to spend too much time on all of these because we've got other stuff to talk about. So we'll move on to IT band syndrome, because that's another common one. So, the iliotibial band is a sheet of tissue that envelops the thigh muscles on the outer aspect of the thigh, what we call the lateral aspect of the thigh, and it runs from the hip down and attaches to the tibia just below the knee joint. So again, this is a really common issue with runners. That tissue can get quite tight, particularly when running long distances, and then with the repetitive sort of bending, straightening of the leg when patients are running, that can cause inflammation, commonly down at the knee, on the outside aspect of the knee. And I have a lot of patients who come to me with really specific pain and tenderness in that area, which comes on very predictably after a certain sort of amount of time running. Again, treatment of this is very much rehab, a lot of kind of sort of stretching, deep tissue work, occasionally other adjuncts I've used in the past, such shockwave therapy or injections, but really trying to do the non-invasive stuff, and again working on their mechanics as well.
Generally, the ITB or the IT band syndrome, it's more of we mentioned that the PFPS could be something coming from the quads, but the IT band, usually it's more of a glute driven issue, from my experience as well. Generally your TFL muscle, which is up on the outside of your hip, which becomes the ITB, it can be working a little bit too much if there is the weakness in the glutes. So something that tends to be a factor that you'd find there would be the weakness through the glutes. So something that would generally again need to be rehabilitated or worked on in particular.
Yeah, I agree with that.
Yeah. So shin splints is sort of slightly older terminology, but call it medial tibial stress syndrome now. So this is a kind of like an overuse issue with the bone, where you get sort of inflammation, for want of a simpler word, within the bone itself, which is secondary to the overload. So again, marathon runners, people training for a marathon when they haven't got the right mechanics, and they've maybe gone a bit too fast in terms of building up. The amount they're running can cause this kind of overload within the tibia, and they just get, again, pain in the shins or in the tibia. Again, comes on quite predictably after certain sort of distances of running. And again, the way to treat this is to really wind it back and essentially stop what they're doing. Maybe look at their bone health, and again, the rehabilitation aspect is key to this as well.
Yeah, important one. You've got to listen to your body, and when dealing with the shin splints, if it's sore, you've just got to give it the rest that it needs. Continuing to exercise, continuing to do the activities, only just going to irritate it more and more, which can lead to bigger problems than stress reactions. Can end up with stress fractures.
But people also need to consider their footwear, because obviously if they try and run in poor flat shoes with no support, then you're more likely to get more stress. If you don't change the surfaces you run on, and you only run on concrete, then you're increasing your load. If you run on park trails or you run on grass and you've got better training shoes, then these are all ways of trying to reduce your load when you're trying to do increased running. But ultimately, once you're symptomatic, you've got to offload.
Yeah.
Big thing becomes strengthening afterwards as well. Once you've offloaded, strengthening and building your capacity for the muscles within your legs, within your core, within your hips to take the load, so that the bone's not copying all the force through it instead.
And kind of semi-related to that one, I suppose, if you jump down a couple of stress fractures where commonly seen either in the foot or in the hip, when it comes to running rather than the knee, and again, sort of micro injuries that again, overload of the bone, purely down to the mechanics and the way that you're running, you kind of overload those areas, and can get stress fractures either in the foot, which is really common, and as I mentioned, in the hip in certain population groups.
Yeah, I mean, be aware of very localized, high level of bone pain, and particularly night pain in bed. People who have got stress fractures, they usually have pain at night. And these are things that you need to just be aware of and ask the right questions.
I think the other things are all kind of like muscle sprains and sort of overload phenomena of the various tendons around the hips and ankles, and again, for the most part, management of those is going to come straight back to what we said at the beginning, which is just getting you assessed, seeing where those muscular imbalances are, and getting a good rehab program and checking out your biomechanics. We can come back to this at the end if anybody wants to sort of go over any of these kind of topics in more detail, but should we move on and try and touch on some of the other stuff? Yeah. So, there's some of the risk factors to injury, and we've mentioned a lot of this already. So overuse, sort of not training correctly, poor running form or mechanics, and biomechanical imbalances and abnormalities. Weak musculature, as we've mentioned, so glutes and core, so key to this. And then, kind of like as you already mentioned just now, not listening to your body and maybe doing a bit too much. So, people quite commonly get injured when they're fatigued. Not having the right footwear, so important. And depending, some running surfaces may cause more issues than other. So in terms of prevention, it's kind of like gradually sort of ramping up your training. So don't trying to do 2K one week and then suddenly try and do 20K the following week. So build it up slowly. Really important to incorporate strength training and making sure there's enough rest to, again, prevent the overuse and the overload phenomena, and to allow the muscles time to kind of to get used to the load. And actually, something that people don't do is sort of mixing up their training. And maybe doing different types of runs. I think sort of we're creatures of habit, and you go out for a run and then you just follow the same routine path every day, and rather than mixing up the terrain or mixing up the way you do things. What do you think about that?
I'm probably not the great one for that. I do a bit of running myself, and I tend to just run laps of the park when I'm doing that. But it is important to vary it. For me, the rest days are the really, really important aspect of it. giving your body the time to recover and not throwing load on top of load on top of load. That's the really important thing. Listening to your body, and if it's a bit sore, just giving it the time to be able to work effectively and efficiently without being too overworked. That's the biggest thing, is to listen to your body, listen to what it's telling you.
We've always tried to be very much into cross training because obviously some of the stuff you mentioned is soft tissue, and obviously the more cross training you do, and some environments are better than others, you can look after those soft tissues. So swimming pools, using aquatherapy, using low impact activities. Your heart doesn't know how it's working, but you can still work quite hard, and you're doing your aerobic training, which is what you require. Unfortunately, runners want to run, and that's what they do. So they tend to do what they do best. But if you can start to do the strengthening and look after the quality of your muscle groups, as well as doing training and having rest days, then the answer is you'll be in a better position, and your injury profile will probably be lower.
Yeah. So these are sort of example of sort of training programs, and it's all about, sort of periodization, sort of breaking it down into segments, trying, as we mentioned already, trying not to overtrain, but obviously doing enough that you're progressing, and sort of understanding what you're doing within your training. Maybe this is a little bit complex, but do you have any kind of...
This slide for me, the periodization is upping it and having a bit of an intensity to challenge certain parts of your endurance or your speed or whatever it is you're working at, and then back off and have a slower period of time when you can then recover, and then have another blast where you can then have periodization. What tends to happen is people just keep doing the same stuff and just keep ramping it up, and they're not dropping it back and changing it. There's a fine balance between overreaching and overuse. And by overreaching, you are pushing up your aerobic capacity, you're getting fitter, you're increasing your training miles, you're tolerating more. But if you do it too much, then you start to see the stress fractures and all of the issues that we've been mentioning. So that you're on this knife edge all the time between trying to get the optimal training program and push yourself so you can improve, but also not so much that you're going to end up having an injury. So it's being aware of the difference between overreaching and overuse. And understanding the aerobic training zones is all about having a very strong aerobic base, which is low intensity relatively, sort of heart rates of 145 to 155, sublactate threshold, pre-lactate threshold, and then anaerobic training for your higher level intensity training. If you understand that, then as you get higher up the pyramid, then the quality of work can increase and you can do higher level activity.
Yeah, I think in terms of seeing improvements in progressions in performance, overload and trying to reach that little bit further, yeah, it's important. That's what you need to achieve, or else you're not going to necessarily see the improvements, but you do need to not push it too hard, not push it too far. Periodization does become really important. Giving yourself even little rest breaks, weeks where you do a bit less training or less intense, research shows that it tends to improve your performance as you come back to doing more as well. So you've got to give your body the chance to bounce back so that you can push it that little bit harder. Because if you keep pushing it harder and harder and harder, that's when it's going to complain. The training programs as well, there's variety within them is really important too. Like Tim was saying, do the lower base is really important to have a good base, so that when you want to challenge yourself and do higher, more intense or faster stuff, you've got the capacity there to do it.
I think it's really easy for people to maybe get behind a little bit in their training and then just try and jump forward a bit too quickly to try and catch up. If they have a few weeks out or something happens, they kind of try and make up for lost time, and then maybe cause themselves a bit of an issue that way as well.
Yeah, that's where the cross training can kind of come in quite useful too. If it's a case of you need to do a little bit less running because something's a little bit problematic, or it's sore, or you need to take it easy a little bit, you can still work on aerobic training through other modalities, whether that be on a cross trainer or swimming or cycling. You can build the base other ways as well. And then it translates into the running when you're ready and when it's appropriate to go back to doing it again.
Yeah,
absolutely.
So I think it's kind of summarizes what I've been saying already, but really it's about the strength training, isn't it? And I think, as we mentioned right at the beginning, running is really popular because you can just pick up a pair of shoes, head out the door, and go for a run. But no one, when they starts running, and no one's ever, as you said, we're never taught this. No one's ever taught that you need to do strength work if you want to be a runner. But it's actually super important to try and prevent these injuries. And the glutes are so important in stabilizing the hips and the knees. The calves really important in terms of absorbing that impact when you're landing and then pushing off as well. And the core is so important in terms of the overall kind of load distribution. And as you mentioned at the beginning, the back is really important. Your core muscles in your back and your pelvis, getting your pelvic strong. It's also important in that whole and playing a part in the whole chain.
Yeah,
I
I
think
mean,
sorry,
sorry.
Tim.
No, go ahead.
I was just saying that I was going to say it's important that everything through the chain, everything through the biomechanical chain is working and doing its job, because if you've got a little weakness somewhere or something's a little bit slack or a bit lazy or something's overworked, that's when bad habits can kick in. And if it's something that perpetuates as you keep training and doing more and more, problems can arise more so from that. So making sure that you've got the right muscles doing the right job, it's a really important thing.
You need to have a strong frame to be able to do function, and you need it to work in your favor. So if you strengthen things and improve the core, your pelvis, your spine, the spinal muscles, those muscles restrict compression so that they tolerate the load that you're putting through by increasing the running. So if you don't have that support, then the lumbar spine, the lower discs, and everything starts to take a hit because you're not actually strong enough to support your spine. And you're doing the compressive load by running at 3 or 4 times your body weight on tarmac. So it's all about conditioning, maintaining function, but having a body that's fit for purpose. And it's not just the running, it's trying to protect yourself from having running issues. And if you do that, then the answer is you'll do very well. But I see a lot of people with spinal issues who are runners who have compressive issues. And I also see people who've been training a lot who have a lot of tight quality in their muscle groups, their adductors and their hip flexors. And you try to examine them and they can't get more than 100 degrees of hip flexion because they're tight in their hips. They tighten their adductors, they can't get the knees smoothly running or the hip flexion moving smoothly. So if you don't address these and release these things all the time, then the more training you do, everything just gets tighter. And then your level of function gets worse because the range of movement has actually got less.
Yeah, and that's right. It's so true, and that's where the stretching and all of that is so important in terms of pre-run stretching and especially post-run stretching. Really important as well. Talking about strengthening work, but you've got to do the stretching as well.
And it's dynamic stuff. So the more you do to release this, the better your quality of muscles. Therefore, you can get the range, and everything moves very well. You feel pretty good.
Yeah, and one thing I find is that no matter who you are, pretty much everyone has got imbalances somewhere within that chain. If taken away from running, someone's biceps is going to be big, is going to be stronger than their triceps, or vice versa, most likely. Yeah. But so there are muscle imbalances inherent in human beings, and alignment imbalances, and so everyone should really consider that when they start running. Obviously, I don't know how easy it's to go out and get an alignment check before you start running, but it's just something to think about, isn't it?
Yeah, I mean, there's a lot of places that do look at people's running function and they set themselves up for that. I went to Harvard University on a sports medicine conference for a week, and they had a running re-education day at the end of it all. And it was barefoot running and looking at people on treadmills and looking at whether you're a rear foot, midfoot, or a forefoot striker, and trying to analyze your gait and your cadence and your forward lean and look at your posture and all the stuff that will change your biomechanics and improve your running gait. People tell you that it's an economical activity. Well, for most people, it doesn't feel economical. But for a marathon runner to be running at 21 kilometers an hour and do an hour marathon in 2 hours, you've got to be pretty economical. So there are people who are very exceptionally good at doing that and have the ability to have a decent stride length, decent cadence, and a flight phase, which they get away with and they can perform at a high level. But for the majority of people who are runners, they're not at that level, nowhere near. And so they need to consider what their parameters are, because they're different to most people. And you only have to walk down the street and follow people and look at the foot in front of you, and I'll guarantee some of them will have one foot going straight and the other one's externally rotated, or they've got a genu valgus or a genu varus, and everything's different. Wherever you look, there is difference in people's function. And so you try to put that onto running, and it's going to have an effect.
Yeah, absolutely agree. So when should people ask for help? I think, if there are any concerns, if anyone sort of has heard what we said and kind of think, actually, that I sort of fit into that category, or I'm having these symptoms when I run, then it's always better to try and nip it in the bud and sort of ask for help early, I feel, rather than necessarily running through it and then actually getting to a point where you've gone beyond simple measures being able to help you. So things where pain's coming on predictably, that's affecting the way you're walking or the way you're running, swelling, as you mentioned, Tim, already, night pain, key thing to look out for. Giving it a chance, maybe resting it up and seeing if it gets better just by resting it and winding it back a bit. Do you two have any other kind of things that you can think of?
Yeah, I think it's not abnormal to have some soreness after training. That would be one factor to consider. If you're challenging your body, you're loading your body up, it's normal for there to be some soreness, but the timeframes that lingers around is probably more the factor that I would be pushing for. Or if there's a pattern to the soreness, every time after you run it's sore, or it's particularly bad at night time after you've run, or whatever it might be. If there's a pattern to it, that would be something that I would be more aware of. For me as a physio, it is certainly a lot easier to rehab someone earlier when the issue arises than if they're waiting longer down the line. Generally, because issues are going to progress and become more serious if they're left longer untreated or continued to be trained into or trained beyond what the body wants to do. So getting that early assessment, getting that early treatment diagnosis is going to be really effective as well. But it's listening to your body, and if it's not improving as you'd expect it to be, that's when we'd be looking for help.
I think from my perspective, the disheartening issue for me is the time it takes for people to present. They keep plodded on with the same patterns, expecting a different result, which was Einstein's comment, which is he kept doing the same thing. It was the first sign of madness. I normally say to people for rehabilitation that if you're going to give them a change and try and put in a strategy in place to help, there should be a benefit within the 5 or 6 weeks, and you should notice a significant difference. And if that's the case, then we push on and do a bit more. But it's trying to educate runners to try and access services earlier than later, so that we can deal with them at a much less significant stage, rather than picking them up 4 weeks before the London Marathon with bone pain.
Absolutely. And then I think, as you just mentioned, when it comes to the rehabilitation aspect, is that some exercises don't work for certain people. So sometimes mixing those up and trying different things, rather than saying, well, I tried this and it didn't work, and then stopping there, isn't it? So it's really...
Yeah, absolutely. So it's trying to come up with a program, give it a go. If it doesn't quite work, tweak it, move in a different direction, but challenge all the time. And that's what will make success. Whereas some people, A, they're late to present, and B, they don't get good advice, and they don't access it early. And that's the key. They need to find people to give them good information so that they can be monitored and pick them up and see what their risks are and what seems to be their functional abnormalities or the gait abnormality, and where are the pains, and is this just DOMS and general muscle soreness and rest and we'll recover it, or is it more than that?
Yeah, and sometimes I think they just need that reassurance that there isn't something serious going on to then be able to push through their rehab program. Sometimes it's the pain that there can be pain when you rehabilitate from these things, because you're stressing and you're challenging the body to do things that it doesn't like. through that strength work, and sometimes that can create pain, and then there can be that concern that they're doing more harm, but that's not necessarily the case. And so again, that's probably that's when they maybe need to seek help, just to make sure that there isn't anything, so they can then sort of carry on through their program without any sort of fear.
Yeah.
Great.
So key takeaways: train smart, strengthen the key areas, or strengthen the right areas. Listen to your body, and as we've mentioned, if there are concerns, it's not getting better, think about getting help, and getting help before it gets too bad. So I mean, one of those things for me is I see a small percentage of patients, as you said, who come quite late, where they've got, rather than a tendonitis, which is an inflammation of the tendon, they've gone beyond that and become tendinopathic, where the tendon has actually changed its internal structure, and that's something that's really hard to deal with. You can't really reverse those changes, and again, getting on top of that can be quite difficult. And a lot of the time, we have to sort of start thinking about interventions, whether that be some form of injection therapy or sort of dry needling, etc. Things like that, and they're a lot harder to deal with purely just with rehabilitation, as has been my experience.
Yeah, certainly. The more advanced the issue becomes, the longer it's been there, the harder it becomes to rehabilitate. In that, there's more changes within the tissue, but there's also more changes within other areas of the body as well that begin to compensate to try and protect for what might be sore. If you've got a sore knee, it might be a case of your hips doing different things to help out for that, but then you're trying to unpack that part of the puzzle too when you're trying to improve what's going on. So it becomes so much more complex and complicated, and it can be a much longer recovery process if things are left unattended to, and then they progress and progress and progress and get worse.
Yeah, and I think that's the key point. Is these kind of issues, you have to be patient. It can take a while to get on top of things on it. I think that's the last slide. So you can either go back to some of the pathologies or go to some questions.
Would you like some questions?
Yeah.
Yeah, fire away.
Any tips for releasing, keeping the iliosacral joint flexible? I've been told by a physio that my left iliosacral joint gets immobilized, causing a running imbalance and some lower back pain. Seems to be flaring up again, but not sure how to release it.
Okay. Releasing the iliosacral joint. I think hip and lower back mobility work is going to be quite important in this scenario, in terms of stretching through those areas. It very much depends on where the imbalance is and what's causing it as a strength aspect, and why the issue's there for more of a corrective approach, whether it be maybe a little bit weak in the core, or a little bit weak in the glutes. Possibly strengthening work could be useful. Releasing a muscle, there's lots of options you can do with that in terms of stretching or trigger point balls or foam rollers, things like that. But if we're specifically talking about the joint, it's going to be more trying to stretch and mobilize in that sense, would be my thinking.
Yeah. Next question. Research is currently saying post-exercise that we shouldn't stretch anymore. It's all about mobility. Is there actually still a place for stretching?
You can have a debate about this for quite a long time. Brent, do you want to say your thing?
Yeah, I think mobility work is probably more important for mine than stretching specifically. I'd be more interested in the way that the whole chain and the whole body is moving, as opposed to stretching one muscle specifically. For me, if you've got a muscle that is quite tight, yeah, stretching it can be useful to try and release it. But the tightness is also coming from a specific cause, whether that be that the muscle's a little bit weak or that it's being overworked. So there's other things to unpack around that as well. So if it's a tight muscle and it needs to get stronger, well, then the strength work's going to be a lot more important. If it's a tight muscle that's working too much because other muscles aren't strong enough, then that's something that needs to be addressed too. But I think the stretching as a mobility approach, quite important. in that for you to be able to move and do what you need to do effectively and efficiently, you need adequate range of motion. So there is a place for stretching, definitely.
Yeah, my perspective is it needs to be dynamic. The passive stretching is not so effective. If you do things like PNFs, which is proprioceptive neuromuscular facilitation, have a force against it, then stretch dynamically, then you don't tear muscle groups and you can increase the range. And it's the range you're looking for and the motion. I tend to palpate everything. So I feel the quality of groups and look at groups to see whether things are relaxed and showing no irritation. If you've got a back irritation and there's a sciatic nerve that's being squeezed, then you'll have a tight hamstring group compared to the other side completely with a positive Tennell's test, which is showing signs of nerve irritation because there's compression. So you need to look at whether there's other pathologies that may be causing some of these symptoms, and you need to try and do stuff dynamically more than passively.
Thank you. I tend to find my lower legs get tight very quickly when running. Is there a way to prevent this, or is it part of getting older?
I don't think it's part of getting older. Is there a way to prevent the tightness as it's happening? Again, if it's tight because the muscles are tired, I would say that the strengthening is quite a big thing. Getting stronger through the muscles so that they can tolerate more activity, more load would be my primary focus in this scenario. You can do the stretching before you start running, or you can do the stretching during to sort of alleviate a little bit of that tightness too. But I think the longer term fix for lessening the tightness that is there is going to be getting stronger in the lower legs. If it's the calves that get a bit tight, trying to strengthen through the calves, or if it's the hamstrings, trying to strengthen through the hamstrings. But yeah, the strength work's going to be the big thing.
Yeah, I agree. I think that's just an indicator of the load the muscles are taking, isn't it? And that's why they're getting tight.
Yeah.
And generally, for me, it's the deeper compartment that's usually more at risk than the superficial. So it's the tib post particularly, which is at risk. People have a lot of pain deep, so doing a drop knee stretch versus a straight leg stretch. But the key is strengthening the groups.
Yeah, strength indeed.
Thank you. How often should we be replacing our trainers? Are there expensive brands actually better, or is it just good marketing?
Very subjective question, that one. It depends on the amount of activity that you're doing as to how often they need to be replaced would be the main thing. Looking for signs of wear in the shoes, in the soles of the shoes, is going to be important to see when they need replacing. It's not necessary. I mean, there's some places which might give certain kilometres or mileage, but it all depends on what you're doing, how much you're doing, how much brakes you're having in the footwear as well. So that's a very tricky question to ask.
You'll get some people who say 6 months and that's expensive. But it is down to volume. But as you both said, it's wear and tear in the trainers. If you look at the soles, you look at the heels, you can see whether they're wedging away or whether one side is getting more worn than the other, and it shows you where you're striking and where your forces are. So if it's starting to affect the sole of the shoe, then it's probably time to replace the shoe.
I think a good thing too is that having multiple pairs of trainers, if you are doing more running, is a good option as well, so that you're varying what's happening around your feet. But if you've got a newer pair and an older pair, it's something you can compare as well, the amount of support that they are giving you. If you notice a big discrepancy between the two, it might be a case of that the older pair might be ready to go out and then get another new pair in as a backup.
And there's some well-known makes that are sort of targeting runners, and they offer different levels of support in terms of the gel insert or the air insert, support, or whether there's more antipronation, etc. These are all different models on the market, but the only one I would suggest that if you do have some restriction in ankle movement or your forefoot, then a hocker with a rocker base gives you some ability to run a bit easier because you've got a rocker shoe rather than a flat shoe. So in certain people with pathologies, they can be of use. I've got quite a few people who use them who've got some abnormalities, and they find them quite useful.
I think the type of running you're doing as well matters as to what type of footwear you're aiming for. Track running versus road running versus trail running, like you're going to need different levels of support and a different type of shoe. So making sure that you've got the appropriate shoe for the activity that you are doing is a really, really important consideration as well.
And I think a lot of these the shops now do kind of like a running analysis, don't they?
Yeah.
And you can kind of always have a look at how you run in the various trainers to see the difference. I think that's actually quite useful.
Yeah, that's the training trend now, and having 5 pairs of trainers and running on a machine and people looking at you and showing you what feels comfortable, what looks different, is a good way to start to make some decisions, because at the end of the day, the top end trainers are not cheap, and if you're replacing them fairly regularly, it's expensive.
Yeah.
Thank you. Is there any other advice you would give to runners with high foot arches to prevent running injuries down the line?
Footwear is a pretty important point, I think.
Yeah, podiatry biomechanical assessment, I think, is pretty important. But we were fortunate in the military. We had a gait analysis, which was there for scientific research, but also for clinics. So we could have somebody in who came in as like a peds cavus, and they'd say, well, I've got pains and this is what I've got. And we'd put them next door, and within 10 minutes, we'd have their load patterns, left and right foot, showing the newtons, heel strike, midfoot, stance phase, everything. And we could then run them down the runway as well. And then we could get that data. And it would be very useful in giving us information of where they were looking for asymmetry, because the figures were different. Now, not everybody has that ability, but there are people who do the running assessments, but also do gait analysis. And if there's an opportunity to be done on a gait analysis, it can be very useful in giving some feedback on runners.
Yeah, I think footwear's the big factor in this situation for mine. I think making sure the shoes are appropriate to what's happening.
Thank you. I have patella ulcer and have just started running. Do you have any recommendations to prevent injury, knee pain, knee dislocation?
I mean, I think, I suppose the key question is, have there been any knee dislocations before? But the simple answer to that is kind of like what we've already discussed, which is kind of get assessed, have a look at the alignment, because there could be other issues here in terms of how things are working, muscle strength, see where the imbalances are, and really do a strength training program, and then build it up slowly.
Yeah. Agreed. Strengthening is the important thing, and then a gradual introduction and slowly build up your kilometers as is appropriate, or your miles.
What are your recommendations for running with sciatica?
There's no need to not run because you have sciatica, is one thing I would say. I think part A is going to be address the cause of the sciatica. If it's something that's related to being a back problem, strengthening appropriately there, working on mobility or neuromobility, making sure that you've got appropriate strength and control is going to be important. Beyond that, it's just listening to your body. If you've got issues with sciatica and you can run 1 kilometre and it doesn't flare it up, well, that's perfectly fine. If you can run 2 kilometres, it doesn't flare it up, that's perfectly fine. But just finding that level that you can manage, and then working around that and gradually trying to build is the thing I would be aiming for.
I'd say the same, but also include cross training, because you don't have to run. You can run in a swimming pool, you can have a flotation belt, you can do aqua jogging, you can be at the deep end, and you can run and do running motions and do plenty of aerobic activity. So mixing and matching so that you're not always doing impact is the way to manage it when you're symptomatic, really.
Thank you. We have a couple of questions that are a question, part statement, but I'll pose them to you because you might have some insight. Why do doctors and physios brush off knee pain or IT pain, band pain as old age issues instead of understanding it could be a runner's issue?
I'd certainly would consider ITB syndrome as definitely as a running issue and not necessarily an old age thing.
Yeah, I don't see it as an old age thing. It's a flexion extension repeated issue.
Yeah.
Yeah, I agree with that. I'm not sure why that's happened, but yeah, I think we could all realize it's a dynamic issue in active people. So yeah.
You can be young and you can be old and have an IT band problem. Would be
Maybe have a chat with other therapists.
Yeah.
Thank you. I suffer chronic back pain. It doesn't hurt too badly when I run, but it is rather painful during the night or when I wake up. Maybe the question here is, should they look to speak to a professional about the pain?
I think they need to see an MSK clinician, either allied health or doctor related, but somebody needs to do an assessment on them to have a look at the symptoms and signs and assess it. If they've got night pain, then it is significant. And if they've had chronic back pain, then they probably need an assessment to see what the potential causes are and the differential diagnoses.
Yeah, I think it definitely could do with an assessment. It's one very difficult to offer much of an opinion around that, but having an assessment from a physio or MSK physician would be useful, worthwhile, definitely.
Thank you. We have one final question. Well, the two final questions. They're very similar, so I'll group them into one. I feel like you've covered this in your presentation, but maybe it's a good way to finish up. Are there any early warning signs of injuries that runners often ignore, or early warning signs that we should all be aware of as we start our running journey or continue our running journey?
I think excessive soreness that doesn't settle within a shorter time frame after training is the big thing that I would be looking for. Like we said before, it's okay and it's normal to have a little bit of pain because you are training harder, because you are doing more, especially if you're trying to improve your capacity. If it's something that perpetuates and continues after more than a couple of days or a few days, or the pain continues to worsen, that would be one thing. The other thing that we touched on as well was the night pain. Night pain is a really big thing to be aware of. If that's something that's turning up, maybe it's something that needs to be addressed.
I think for me, you're bang on with what you've said, and I fully agree. But the only other thing I would suggest is that we have a variety of people who are trying to run from the couch to the 5K to the marathon to whatever, and even the ultra marathons. And they're all completely different. So relatively, it comes down to what people's level of activity is. So some people are very active and have already a decent level of function. Other people haven't actually been very active. So as we've said already, it's all about listening to what your symptoms are and how things go as you start to progress with activity. If you're doing low level activity and you're just starting, then you just need to have some common sense about how fast you accelerate. If you have a decent level of activity, then obviously you can accelerate a bit more. But it's being aware of where you are and how things change with activity.
Yeah, I agree with that. And then the other thing for me would be just keeping an eye out if you have reproducible symptoms, that the same pain comes back every time you do the same thing and it doesn't get better, despite maybe resting and doing other things, then maybe just be wary of that, and that may be a time to get someone to have a quick look just to make sure there's nothing to be worried about.
It rings alarm bells.
Yeah.
Thank you so much, everyone. Those were our last questions that have been shared, and we're almost perfectly on time, so that feels like a perfect way to end. I don't know if any of our wonderful speakers have anything else they want to add before we finish up.
That's been very useful.
Thank you for coming, everybody.
Good luck, everyone.
Yeah.
Thank you so much, everyone.